Thank you very much, and thank you very much for inviting me to stay a couple of days longer after the handball conference, which was great. When I hear numbers like Robert tells me now about the injury rate in this World Championship, I'm not so surprised, because we know there's a lot of injuries in matches, and there are mainly, when we look at ACL injuries, there are 30 times higher risk in matches compared to training. So playing handball matches is a tough game. Today I want to go through, I will more or less all the time talk about handball. I will touch a little bit upon football at the end, but just very shortly about the injury location. When we look at all studies that have been done on handball and looking at both overuse injuries and acute injuries, we get numbers like this. Did you see that? Is it the small one here? Up, the big one? No, not that one, not that one, this one? Is it? Yeah, is it this one?
No. It should be the next one. So
No.
yeah, oh, this one is back.
Yeah, but the pointer?
This is the pointer.
Ah, they hide the pointer. Okay, so when we look at all types of injuries, we see that ankle injuries are typically injury that we often see. Knee injuries, thigh, low back, hand, finger, and shoulder. No, I think we actually jump one. First, when we look at all the injuries, both overuse and acute, you see there actually some studies have shown that there are a lot of head injuries in handball. Shoulder injuries, 5 to 15% in the different studies. Knee, 18 to 20% of the injuries, and ankle 9 to 45% of the injuries in different studies. And when you look at acute, you see that knee and ankle are really prevalent. So, and this is the study by Merete Møller in Denmark, and she followed elite female and male handball players. So these are numbers for both male and females, just to have to keep that in mind. And when we look at the overuse injuries, we see that shoulder point out to be a main problem, together with knee problems and leg injuries, shin splints and things like that. So when we want to prevent injuries, we should take the injuries that there are the most of. And actually I want to start with talking about ACL injuries and trying to do something about that, how we managed to do that. Because late in the 89-90 we had 2 follow-up studies where we looked at ACL injuries among male and female handball players in Norway at the 3 top level. So the best players in Norway was followed, and it was elite 1st and 2nd division. And what we found there was that the female players had a 5 times higher risk to have an ACL injury compared to the male players. And we thought we had to do something about that, because we know that the severity of this injury is it's a tough injury to get. You are a long time out of play. There's a lot of pain and disability. It reduces the quality of life for the athletes, because they are taking out of the play, out of the team for a long time. And we know it's an expensive injury for the society. And we know also it could be very expensive for the society and for the person, because of the long time risk of future osteoarthritis, which we know that a lot of these athletes get, and actually quite early. And the 2 main injury mechanisms, on the right side you see the one leg landing, which is, we often see it. So of course, if you want to prevent this injury, the easiest way to try to do it is to land on 2 legs. So if we get these athletes to land on 2 legs, probably the number of ACL injuries in this situation would have been reduced. The other main situation is the one you see on the left side, and this is the most common way of rupturing the ACL. You see this cutting movement, and the way she's doing it, she's landing with a very wide stance with a large hip abduction, and when she's just doing a small turn to the left, her ACL on the right knee is ruptured. And this is actually the most common way of injury your ACL in a cutting situation. About 60% of all ACL injuries happens in this way, and in the attacking phase. And what's always also quite important to know that most of these injuries occurs in a non-contact situation. So this is not handball as a hard and contact sport, but it's actually a situation where there are no contact or maybe a small perturbation from the defender, but mostly a non-contact situation. This is one of the national team players, you see there. She ruptured her right knee there, and you see it quite well. And by having video cameras, getting the videos from 3 different angles, we had the possibility to get more knowledge about how this injury occurs, at what time this injury occurs. And for those of you who saw Hide Kogas in this lecture, I think it was Friday, about injury mechanism, you could see how he explained how this injury occurs. And this is really a hard work. They use about 1 month to put this skeleton into all these frames, in every frame. And by looking at this and seeing how they do it, they have found that the injury occurs probably by 0.40 milliseconds after you put your feet on the ground. So it actually happens so quick that the athletes can't think, I have to get my muscles fired to protect me. It has to be a pre-activation of the muscles to save you in a situation like this. So we know already back in the 90s that a cutting movement and a one-leg landing was the main injury mechanism. So we saw that the valgus loading of the knee was not good, and we asked and really focused about try to avoid valgus loading, because that's what we see in almost all of these injuries. So we started the ACL prevention study, and this was among 60 teams, almost 1,000 players, at the 3 top level in female handball in Norway. And we choose the females because we need to have a lot of injuries to try to see a reduction. And among males there were so few that we couldn't test it on the male. And what we did first was that we had a control season where we only counted the number of injuries and the injury mechanisms. And then we had 2 intervention seasons where the players did a prevention program, which consisted of 3 types of exercises. 1 type of exercise on the floor, 1 type of exercise on a balance mat, an ARX mat, and 1 type of exercises on a wobble board. And the squat was divided in 3. So during 15 minutes they had done this prevention program. And we all the time focused on the knee over toe position. It's almost like a slogan, so the players always remembered, keep your knee over toe. Maybe it's not so precise to say biomechanically, but they understood what we meant. And we focused on 2 legs landing, hip, knee, toe in line when you are doing cutting movements, and focused on balance, strength and plyometric exercises. And here you see some of the exercises. This was just a running exercise where you do a small cutting movement to just warm up your knee. Here you see different jumping exercises, and of course a lot of these balance exercises where we focused on the hip, knee, toe in line in all the exercises. And trying to throw some different difficult throws to each other was also one way of doing it more difficult for them. Doing squats on a wobble board while you're throwing the ball, and again focusing on the hip, knee, toe in line. And of course a lot of these exercises that you see here is also rehab exercises, so they are very close to what we do in the rehab after an injury. Jumping exercises, this one I think is important where you give the athlete a push, so they have to try to land with flexion in hip and knees, even though you have been having a perturbation. And trying to keep hip, knee, toe line straight, even if you do these fighting exercises. Punching the ball with closed eyes on one leg on a wobble board, of course it's not easy, but it's nice exercises to improve your neuromuscular control. So we did this program, and here you see the number of ACL injuries on the y-axis. So in the control season we had 29 ACL injuries among those 950 players. Then it went down slowly during the 2 intervention season to 17, but it was not statistically significant when we looked at all the 3 levels, the elite, first and second division. But what was really interesting, because the compliance was not good. It's hard to get players, the coaches, to do this stuff because we don't have time to this. But in the elite level, the compliance was the best, but it was not more than 45% of the players and teams who did it in the elite division. However, among those players who really did it, it protected them, because we found that the players in the elite division who didn't do these exercises, they had a 16 times higher risk of getting an ACL injury. So this type of exercises, it protects the ones who do it. And that's so important to keep in mind. You have to do the exercises. So then we asked ourselves, why did it work? And we had some studies looking at that as well. Some testing showed that this type of exercises improve the dynamic balance. This test was done among the same players. And the Danish group led by Mette Sebis showed where one important thing was that she tested handball and football players with EMG on the lower extremity before, in the cutting movement, before they started this prevention program and after they had done the prevention program. And what she found was really interesting. She found that the neuromuscular training induced a selective upregulation of the semitendinosus EMG activity during a standardized side cutting maneuver, which potentially could reduce the risk of dynamic valgus. And we want to avoid the dynamic valgus. So getting these muscles pre-activated before you put your leg on the floor could save you from getting this ACL injury. And that's why it's so important to keep the medial hamstrings strong. And since we know that maybe 80–90% of reconstructions today are with hamstrings, it's so important, if you use hamstrings, to use time to the rehabilitation so they really get strong enough in that muscle. They also found that this prevention program increased the jumping performance, so we then can sell it for the coaches that this program increases the performance. So we can sell it less injuries and better performance, and maybe we can reach the coaches then. So I think this knowledge about the medial hamstring is important, and they have shown this in studies after this as well to confirm that this really happens, the pre-activation of the medial hamstrings. So what happened after we withdraw from the prevention teams? Because here, from telling you that the number of ACL injuries, now we have on the y-axis the number of ACL injuries per team per season, instead of counting the numbers. And here is the control season, and here are the 2 intervention seasons. So from about 0.5 injuries per team per season, it went down to 0.34. And the teams continued to have their equipment, so they could actually just continue doing this prevention program. But as you see here, it didn't happen. The injury rate increased again, and actually to even higher level than before we started. And we thought we couldn't look at this because we hadn't done anything more. I had written my thesis in this period, so we hadn't continued to work with this. So we found out we needed to do something. So we had to do something about the implementation, because it was really not implemented in the Norwegian handball. So we made a DVD, and we had seminars in Norway's biggest cities, having a lot of coaches, the handball coaches, a lot of players on the seminars, to teach them why this is so important and how you can reduce this risk of injury. And in addition, this study, we performed this study as well. And this is a randomized control study because the ACL study was not randomized. But this is a randomized study where we also included the boys. These were girls and boys 16 to 7 years old. And in the cluster randomized study, we had an intervention group with about 950 players and almost the same in the control group. And now we wanted to test the effect of a warm-up program to reduce the number of knee and ankle injuries in handball. Because at that level, when they were so young, we couldn't have only ACLs as an endpoint. We needed also ankle injuries to really could see a change. And this was performed all over this part of Norway. And here you see the numbers of players in the intervention group and the control group. And you see there were less male teams than female teams, but that's the way it is. Most boys and girls boys play soccer or football. So there's not so many handball players among the boys. And we followed them one season to see how this ended. And the team coaches reported injuries and training match hours each month. And we had 10 physical therapists who recorded injuries during the handball training or the match. And we divided the injuries into minor, moderate or major injuries, as you know from before. And the intervention were exercises for warm-up, technique, balance, strength and jumps. And we tried to have handball-specific exercises with the ball. And the program lasted for about 15 minutes. And it should be used instead. The control team warmed up as they always didn't change anything. So the intervention teams did this specific warm-up program that we gave them. And there were instructors from the Norwegian Handball Federation who went to the teams and teaches the coaches this program. And here you see some of the warm-up exercises: running forward, backward, sideways and shuttle run with or without ball, throwing the ball. Technique training, again trying to have more a narrow cut. We had landing exercises with 2-leg landing. Balance exercises that you can recognize here from the previous program. And strength and jump squats and Nordic hamstrings. And you can see some videos from that here. The athletes did running back and forth, as you see here. Doing cutting movements, try to keep the hip, knee, toe in line, and 2-foot landing after a jump shot. And this should be done every warm-up during the week. Oops. Let's see. Get this to start. There. We also had these balance and strength exercises, the Nordic hamstrings or the eccentric hamstring training, and this should start with just a couple of repetitions the first time because it's a really hard exercise. Start with 2 to 3 repetitions and then increase the number after you're getting stronger. And balance exercises as you have seen before. So how did this work? Actually it worked really well. You can see the number of injuries in the intervention group and the control group for all kind of injuries down here. And for those 2 main injuries that we looked at, you see a really nice reduction. And we saw again that there were a reduction actually also in the training injuries with 23% reduction. But in the matches, more than 50% reduction of the number of injuries in the matches. Looking at the severity for the minor injuries, also a reduction, but the greatest reduction was in the moderate and the major injuries. So, and when we looked at the knee ligament injuries, it also was great news, 80% reduction of severe knee injuries. And it was 3 ACL injuries in intervention group compared to 10 in the control group. So this warm-up program really worked well, and it also worked in relation to the ankle sprain injuries. So in total, almost 50% reduction by doing this structured warm-up program instead of the program that the coach chooses. So this program really was getting a lot of attention in the media. The Handball magazine, which reaches out to all handball players and coaches in Norway, got a lot of information about it. It was on the television because it was a great news that we really could reduce the number of injuries in Norwegian handball with 50%. So all of this stuff and all the work we had done around the country to reduce or getting the information to the coaches really helped, because this was the numbers some years later, as you see here. It really get a reduction. Oops. So we wondered, is this just a natural variation, or is it really because of the work we had done, the new study and all the implementation work we had done? So we needed to follow this continuously. So we followed it for 4 more years. And what happened the next year, in 2008, we made this website, which is called Skadefri, or Free of Injury, if you will. It's better in English. But this was free for everybody, and they could go in there, download every videos, could see and get a lot of information about also how you treat injury if you get it. And in addition, Katlin Steffen was employed at the center to work with implementation. So we put even more effort into the work of implementation. And here you see the Free of Injury website. So the athlete could, or coach could, just click on handball, or they could click on knee, and then they come directly into the different training programs that they could use. So this was the website that was used a lot among the coaches. In addition, during the European Championship in 2010, we made videos of the national team players doing different kind of exercises, which was shown during the European Championship on the Norwegian television. And of course, the young athletes, they listen to these girls, they don't listen to me. So of course, when we have national players doing, showing them good exercises that could help them to prevent injuries, of course that helps a lot. And they also showed what you shouldn't do, and all the nice things that happen if you train hard. So this is how it looks like until 2011. And you will see we have had a stable reduction and kept this reduction for those years. And here we had the website, and of course achieving this has been important for Norwegian handball, but it doesn't help for the rest of the handball world if it doesn't get used. So this reduction is something we hope it's still there, but we are working with it now to see if it has raised again or if we have kept these numbers low. But I think and this story about this, the whole thing has been published in BJSM in this Mission Possible issue. So you can read more about it if you want. So we also say, why have we succeeded in this? I think it's huge efforts, a massive implementation. We really worked hard with that in Norway. We have personal contact with the coaches in every club twice a year. We call them and ask, okay, are you using the prevention exercises? How often? What kind of exercises? So they are getting reminding that this is actually something that you should do. We have this website and the DVD. We have had courses around the country. We have a close collaboration with the Norwegian Handball Federation, which really are happy that we are doing this and support us with the work. We have these articles in the Handball magazine who reaches everyone. And of course, we also have a lot of focus in the media. And hopefully we have improved the coach awareness and acceptance for putting this kind of exercises into the warm-up. But it's not only a success, I think, because we have this national registry of ACL injuries in Scandinavia, and you know, we have been working a lot with the grown-up players, but what happens when they are 14, 15, 16? And what we see is that there's so many handball and football girls 14, 15 and 16 years old who rupture the ACL. And if you look at this graph, blue is male and this is red are girls, and you see that the age of when they are getting reconstructed is very early. It's a peak for the girls around 16. So yes, we probably prevent a lot of injuries, but we don't prevent enough. We need to reach these young girls in all the pivoting sports. So it's it's a big job, large job for, continuously to work with this. And I want to show you this video because I think if we are going to succeed, we need to start early. They have to do this kind of exercises to learn good technique, safe technique early. I can't try to change the way a 25-year-old girl doing the cutting. It's difficult. But if you start when they are early, when they are young, then we have the possibility to do a change. Let me see if we get it. Ready, go? No, that was fail. You can take off the sound if someone can do that, or can I do it up here? This is the sound button here, probably. Maybe there. I don't have my glasses, but anyway, we can go back. Just want to get this video on. There. So this is how the one coach have one of his trainings. Once more. It's not so easy to find this. There, hopefully, yes. And you can see how he's making a handball training, a warm-up during a handball training. Funny, and of course, I think he really improves the neuromuscular control, not only in the knee, but the whole body. And the girls like this. I think that's also important for the athletes. Having fun and make it difficult for them. And this is quite difficult when you have these Erics mats. And no injuries during this. So they're quite good actually in this. You probably should follow those girls and see if they got injured, but I don't know how it went with them. But I think this is really so this is things that I think maybe could have been used much more to play, have fun, and for these girls you use the ball. And I also showed just a video from, we always say that you have to do your training program anywhere, but you can go on your vacation and do the training for core, for hip stability, the knee stability, which you will see here. And you, sorry for the I know the sound is away. This is one of the young national team players in Handball Norway. She's doing this training actually with her father, just using an elastic band, and she's doing a cutting movement, hip, knee, toe in line, and of course she's getting much stronger because it's quite heavy to do this exercise. Yeah, it's a Toscana. So it's possible to do good training for all wherever you are. So we could sum up this part that ACL and ankle injuries can be prevented using warm-up with knee control technique, strength, balance, plyometrics, and core exercises. For avoiding ACL injuries, you need to practice a more narrow cut with flexion in hip and knees, avoid internal rotation in your hip, and practice two-leg landings with flexion and hip and knees, because then you reduce all the force over the knee. Just very shortly, this to touch upon football, because there are so many studies out there now. This is the 11 plus, the FIFA 11 plus, which shows great results. You see some of the exercises here. Running, 2-leg landings after a jump. This is very typical. And this was performed on 16-year-old girls because, again, there's a lot of ACL injuries among football players, female football players. And they also had jumping exercises, launches, and again, hip, knee, toe in line, all the time focusing on the knee control, the core stability, to avoid the valgus position. And again, core stability exercises and balance exercises. So this is exercises that you put into the warm-up instead of the warm-up that maybe the coach usually uses. And this 11 plus program is now used in very many countries in the world to try to prevent injuries. And we have also this final running exercises to speed up before the training starts. So, and you also recognize this exercise, Sprung Life. And just shortly show the results from that. This is the intervention group. It was, you prevented injuries for all these groups because it's under the one line. So for the intervention group, they had lower number of injuries for all of these types of injuries, but they were significant for the overall injury, 32% reduced risk for overall injuries in the intervention group. For overuse injuries, which is really interesting that you actually can reduce the overuse injuries with this program, and for severe injuries, 45%. So it's really possible to do something in football as well. And I just want to mention this nice study from Sweden. It's also football. They had more or less the same warm-up program, got a 64% reduction of ACL injuries among girls in Swedish football. Here you see some of the exercises again. And they work with improved knee control, with jumping, strength, balance, and coordination. So you see all these programs include more or less the same type of exercises: flexion in hip and knee in landing, balance, coordination. And also just this floorball study from Finland. This is a nice study preventing injuries in the lower extremity in floorball. And finally, I showed you the incidence slide and the prevalence of overuse injuries, and you saw that shoulder pointed out to be an area that we needed to do something with. And we are now doing a prevention study and a randomized control study in Norway, in the elite and the first division for both male and female players, because we have found that both female and male handball players had the same prevalence of shoulder problems. So to try to reduce this overuse problem, we have started a randomized control study where exercises mainly they are based on the risk factor study we did a couple of years ago, and we are strengthening the external rotators. We have trying to have a scapular stabilization exercises because we saw a lot of dyskinesis in the scapula, capsular stretching, and plyometric exercises. And hopefully in half a year or 8 months we know how this works, but the problem is the compliance, the players' compliance. How much do they really do this exercise? How keen are the coaches to do these exercises? So it's so important to have the coaches on our team. So the coach is really important. We need to have the team coaches with us, because if we want to change something on the training, try to implement something else in the warm-up, the coaches need to understand it and be on our side, and understand that if you have players who are healthy, then you can win a world championship. You don't win with the players here at Aspetar or on the sideline. So I think it's important. So the future question is, do we need to confirm the intervention programs, how effective they are? I don't think we need so much more confirmation, because we know that this work. But what we don't know, is it necessary to have all these types of exercises? Are there any exercises that points out to be the exercise? Because if you could have 4 minutes with prevention training and you are safe or safer, that would be great. But it's hard to find those exercises. And how long time do you need for neuromuscular adaptation to develop in response to training? We don't know maybe enough about that. Should it be pre-season training or in-season training? I think you need to put this in a warm-up, so it's a standard part of your daily training. And I think we need to start very early regarding the age of implementation. And of course, if we could point out those with increased risk, that we could go more precisely into those and give them some extra training, but it's not so easy to find those risk factors. Just a couple of slides at the end. Maybe you can remember one thing after this, is that we have made a new app, which is called Get Set, Train Smarter, which you can download on your mobile and give to the athletes and coaches you have. And this app is made with all the summer sports, Olympic summer sports, and we have put these exercises for these areas, and we are trying to find prevention exercises that have worked on all these areas. So it's possible to download this app, and you can see all the video clips with those different exercises. So use the app, Get Set, Train Smarter. So with this, thank you very much for your attention.